Good morning, everyone. I'm Megan Cullip, along here with Scott Micklin.
Good morning, Megan Cullip. It's good to see you.
Good to see you.
Happy Monday.
Happy Monday. Happy week 29.
29 it is. Week 29 of the program. It's September 28th, Monday morning, everyone. We're glad that you are with us. Thank you for joining us. Our local community information program about COVID-19. And we're going to go right to the phones today because we have a guest who is waiting, and we have been wanting to speak with someone from the Public Education Department for the state of New Mexico, and our wish has been granted today.
Ooh.
So, how about that?
Look at us.
Yeah. Very excited. Dr. Gwen Perea Warniment is on the phone from the PED, the Public Education Department in Santa Fe. And Dr. Gwen Perea Warniment, thank you for joining us this morning. We appreciate it. Good morning.
Good morning. Thank you, Megan and Scott. I'm excited to be on the phone with you.
Well, it's great to have you on the phone. You are the Deputy Secretary for Teaching and Learning at the State Public Education Department. And so I know probably a lot of our viewers have questions for you, but we have questions for you as well. And certainly juggling COVID-19 and all the local school districts around our state and trying to figure out best practices, I imagine that has been your life for much of 2020.
That's correct. It's been a wild ride, as it has for all of us.
Right. And so, of course, now that the fall semester has started and the school year has started, a lot of folks certainly are hopeful and optimistic about their children being able to maybe return to the classroom, and that is being done kind of on a district-by-district basis, county-by-county basis. Can you give us some insights into how that decision was made?
Certainly. So really in the overview of the past few months and kind of tracking the trajectory of the virus, there was kind of three premises that were really important to the Public Education Department, to the governor's office. The first was really following the spread rate of the virus, the kind of criteria that the medical advisory team had come up with, Secretary Scrace, Secretary Kunkel, the Department of Health, and really looking at what was happening for those communities. And the second was then doing some modeling with the Los Alamos National Laboratory around forecasting what would happen in bringing back students and the role that large groups of individuals play in spreading the virus. So we knew that, how do you model what might happen? So that was kind of the second thing. And then the third was really trying to balance out and look at extensive research on guidance and what was already happening kind of across the world, kind of taking a global perspective around how do you then maybe approach a reentry for schools based on best practices, requirements for safety protocols, really attending to not just an academic space, but socio-emotional learning space and wellness, and then also that huge, overwhelming space of safety and personal protective equipment. So those were kind of the three big overarching things.
Very good. And so, as we know, New Mexico is a rather large state, and we see a lot of different hot spots throughout the state, some counties doing better than others. And so I'm just interested in contingency planning because also as we watch this thing develop, there's a lot of questions about the winter and then what's going to happen in the spring. And so what's the contingency planning looking like as opposed, when you're talking about in-person, online, hybrid, that kind of stuff?
Sure. That's a great question, Megan. So let me give you take one step back and say that for a district or a charter school, state charter school, to be approved for entry into a hybrid space, the date was September 8th, but it wasn't just a date that marked your ability to open hybrid. You actually had to have 4 criteria that you met. One was that you had to have an approved reentry plan with us. The second was that you had an adequate level of masks and personal protective equipment on site. The third was that you're located in a county with a 14-day average of a daily case count of fewer than 8 per 100,000 and a test positivity rate under 5%. And then the fourth was that you had this safety plan checklist that you signed as a superintendent or the executive directors of your charter school that kind of attended to things in terms of air filtration and assuring student groups remained in cohorts, a social distancing plan, those types of things. So I digress and tell you a little bit about that because reentry plan with the New Mexico Public Education Department actually spoke to asked primarily around remote instruction. And it did so because we wanted to ensure that no matter what type of instructional model, whether it was hybrid or even approaching full reentry, whatever it was, you always had a solid foundation or base of remote instruction, because we wanted to have everyone prepared in the case of moving into full remote. If we have to, let's say there's a terrible outbreak of the virus, hopefully not. I think, as long as we wear our masks and we're attending to social distancing. But if there is an outbreak, that everyone has a solid plan in place for remote instruction. So we knew that that was going to be a really important foundation.
Understood. And so I guess then what you're saying, Dr. Perea Warniment, is that as these districts reopen and students start going back to class, that perhaps, depending on how the cases go in their particular county, they could maybe close again and go back to full online learning as the school year progresses if situations change?
Well, we wanted two things. One, we would want to not be so reactionary and make that by default what would happen. We'd actually want to monitor. So if, for instance, a district was entered and was able to move into a hybrid space, but then their county went into a yellow zone or even a red zone, we wouldn't automatically, as a public education department, say, okay, move just reactionary into remote. I think that's too hard on families. It's too hard on students or staff, for that matter, right, as you're trying to plan your curriculum, your lessons. So we want to not be so reactionary as to move back and forth. That this doesn't work in an education system. That being said, if there is a severe outbreak and if there's something that's happening in the community, the medical advisory team certainly will take that and weigh it, measure it closely, and follow kind of what's happening. Again, on this 2-week progression of monitoring different counties and what's happening for them. There is one case, though, that you could have a school closed, and that's if there's an outbreak in the school, right?
Got it. And that's good to know, I think, too, for parents, that maybe this wouldn't be a quick change without a lot of discussion and looking at the numbers, that once things do maybe go back face to face. I did want to ask you, too, because certainly I know a lot of parents, a lot of students dealing with this new kind of virtual learning, online learning, and some students I think are doing very well with it. Others maybe not so much. Other parents may be frustrated, and I'm sure you've heard a lot at your office about some of those frustrations. Do you have any advice for families, for students, or for even their parents, maybe, that they're not doing quite as well as they would like to in this new virtual online learning space?
Sure, yeah. The virtual space is not at all comparable to in-person learning, and we know that. And we know that it's critical to get our students back to school safely. So again, everyone wear your masks because it's very important. I mean, it's important for everyone. We like to say that it's important for our younger kids because it's really difficult for them to be able to navigate this online space. The whole pre-K to third grade space, students need connectivity. They need to be in person. But even for high school students, there's also this really interesting and critical nature of the social space for them. So I'll start by saying that. And then in terms of advice for families, I do think that the more that families support one another in terms of how are you approaching this and interfacing with the teacher in kind of groups and looking at I'm not advocating necessarily that you're breaking your social distancing, but I think just communicating with each other and looking for support systems right now is really important. And how do we band together to help one another in communication and in understanding things? So I'm going to give you a personal experience. My own sister has 3 children, and it's again difficult. All 3 are on the computer at the same time. She's trying to work full time, and her husband works full time, and so just her reaching out to her daughter's friends, parents, and asking how how are they doing this? What does this look like for them? So I think the more that you're actually talking to one another or approaching this in a community-based way, the better off you're going to be, because you have support systems around. And that being said, I think also, reach out to anyone. I mean, I really think the teachers are doing heroic work right now, and they want to help, and they want to know what the needs are of the families, what the needs are of the students. And so don't be afraid to reach out to the teachers, because they're your biggest advocate.
Very good. And so we have one more question for you before we wrap up. When it comes to phasing back in-person learning, we know that it's contingent on age groups right now. And so what's the plan for the older kiddos? Because I believe the ones that are phasing in first are the younger kiddos.
Sure, that's a great question. So we approached the phase-in for the young students in a hybrid way, because we knew that we wanted to keep students in cohorts. And the reason that we do that is because that is one of the best strategies for actually mitigating the spread of the virus. So when you hear about what's successful globally, like these, nations that, and specifically like I think Denmark is cited a lot, or some of these European nations that are doing so in a successful way, or other nations that are approaching return to school, they're doing so by having pods of students, and these pods don't overlap. They create small groups of students, and those small groups attend together, and they are able to socially distance, and they wear their masks, and then an in-person is successful. So we wanted to create that same type of scenario happening for the students in New Mexico. So these cohorts, or these groups that attend an A, B, or hybrid, we knew that's important for early childhood, and it's actually also easier in a lot of ways in an elementary setting, because you have the students typically follow one teacher, right, or a couple teachers, maybe if there's two teachers that are approaching and co-teaching at a grade level. So for secondary, it's not so easy. In a lot of ways, the planning that goes into preparing rostering and schedules for secondary students, middle school or high school, can take months. You usually start in the spring to prepare for the fall. So with that in mind, we're trying to brainstorm right now, look at other models of what's successful, what may have worked across in other locations again, and whether or not we approach that in a hybrid way, or maybe we approach that simply based on small groups, similar to the way NMAA is doing the small groups in terms of activities and athletics. So, pods of 9 to 1 or something like that. So we're actually thinking that instead of a hybrid, it would be something around small groups for secondary students, and hopefully bringing them back if we see that the virus is stabilized. And
so it sounds like it's an evolving conversation, basically. So nothing really set in stone just yet.
Exactly.
Got you. Well, Dr. Gwen Perea Warniment, we appreciate your time this morning with us. Again, we've been wanting to speak with you for a while, and hopefully we'll be able to do so again as we all move forward during this COVID-19 situation with our public schools. Thank you very much.
Sure. Thank you.
We appreciate the information. Thank you.
All right.
Bye-bye. That's Dr. Gwen Perea Warniment. She is the Deputy Secretary for the Public Education Department in the area of teaching and learning from Santa Fe. Interesting stuff.
It's really important stuff. I think that the sanity of all parents these days is in jeopardy during online schooling.
They are trying. And I would agree, I think, with what Dr. Perea Warniment said about the teachers. I think they're really trying to do a lot with what they have. And I know parents are frustrated in some cases, students are frustrated, teachers, I think, are frustrated too in some cases, but they are really trying. And I would encourage anyone who's having difficulty to reach out to either a teacher or someone to try to help them through whatever the problem is they're having.
Yeah, not me for high school math. That's just where my head always goes. It's like, ooh, if I had a kid that was like in pre-cal or something.
Oh, I couldn't. No. You'd have to pay for a tutor, I guess.
Totally.
Yeah, because not in my wheelhouse at all. And my dad was an accountant. Got none of those genes. Nothing. Math wasn't going to happen for me. Anyway.
We have 10 fingers, so that's our saving grace.
That helps.
As long as we don't have to count past 10.
That's right. That's helpful. But anyway, so we appreciate that. Let's get back to the other stuff we want to share on the show today.
Yeah.
Because we have a lot of other stuff to mention. One of the things is certainly the testing schedule for this week. Again, this evening here at San Juan College, it'll be testing from 6 p.m. to 7 p.m. from the New Mexico Department of Health. Tomorrow evening here at San Juan College, Tuesday, September 29th from 6 p.m. to 7 p.m. Thursday, October 1st. Oh my gosh, it's October 1st on Thursday already.
Oh, I know. October. It is my favorite month of the year.
Is it? Mm-hmm. Oh.
Besides June.
Because it's my birthday month, apparently,
Aww.
right? 6 p.m. to 7 p.m. Sorry, audience.
Yeah.
And then Friday morning here at San Juan College, the times are a little bit different, from 7:30 a.m. to 9 a.m. here at San Juan College. That's Friday, October 2nd in the morning, 7:30 a.m. to 9 a.m.
Very good.
So there you go. And again, they ask you to register before you arrive. You can do so online. You can scan the QR code. There's a bunch of these posts on Facebook. You can do that, or you can call 327-4461, 327-4461 if you need help to get registered.
Very good.
So there you go. All right. Next. Talk about more numbers,
Next. Okay.
right? You
Yes,
got your
I got
Johns
it.
Hopkins ready to go?
I always have it ready to go.
Okay.
I'm just going to start taking screenshots of it and making my wallpaper.
There you go. That's right.
So the U.S. confirmed number of cases is now at 7,117,116. The U.S. confirmed deaths, 204,762.
Okay.
Yeah.
There we are.
Global deaths were almost at 1 million.
Wow.
I know.
Right? Okay.
2,000 away-ish.
And we're still seeing some hot spots, I know, across the country in some areas, right? I know New Mexico was a little worrisome there for a while. I think our numbers are still up in the state. Let's take a look at those. Another 159 cases yesterday. But there were no new deaths in New Mexico yesterday. San Juan County had 7 of those new cases yesterday. So our totals in New Mexico, 28,844 cases in our state. San Juan County now 3,327 cases. And again, no new deaths in the state, no new deaths in New Mexico and in San Juan County. And our recoveries were up by 91 for a total of 16,301. So those numbers are kind of being where they have been, at least late last week. And so we'll kind of keep seeing how they go. On the Navajo Nation, again, they had 18 new cases on Sunday, a total of 10,290 cases on the reservation, 3 additional deaths for a total of 555. And I know there are concerns about cases on the reservation going back up. And so in some hot spots, so the tribe was trying to kind of crack that down. There was another curfew again over the weekend. And we'll wait and see if that's been scheduled for this coming weekend too in October. We'll wait and see. Mm-hmm. So what's going on, but we'll see how that goes. So there's that.
Very good.
Yeah. We have another guest.
Great.
So
yes.
are you ready for that?
I am ready for that.
Okay.
We'll see a costume change here in a bit.
We might see a costume change
Yeah.
because that happened. That was a pre-recorded. So let's go to our next guest. Joining us now to talk about some changes for Parks, Recreation, and Cultural Affairs, the city's director of that department, Shawna Reeves, is on the phone. Good morning. Thank you for calling in.
Good morning. Thank you for having me, Scott. I haven't seen your face in a while.
I know. Well, we haven't been able to see each other's faces in a while, but that may be changing. Maybe we'll end up in the same pool at one time. Who knows, right?
Scott, let's not pretend like you exercise on the regular.
Oh, and Megan's here too.
Hi.
Yeah, it's nice to have
Megan.
everybody here. Anyway, but Shawna Reeves, we're glad to have you on because there are some changes from the latest public health orders, and we wanted to talk a little bit about some of those and what that means for Parks and Recreation in the city of Farmington. So I guess first and foremost would be park reservations, right?
Sure.
And field reservations.
Parks and field reservations. So, to be clear, during the pandemic, we never really did close our parks, our trails, our athletic fields, our playgrounds. We didn't do that. Instead, we sanitized them daily and allowed people to use them on a first-come, first-served basis because we thought people, would be cautious and they needed a place to go while social distancing just to kind of, get out and enjoy the sunshine. So they weren't closed. But now that the governor is releasing youth sports for practice formally, we're able to, and she's increased the gathering numbers to 10, we're able to release some of those reservations. So if you want to reserve a shelter for 10 or less, you can do that now. beginning October 5th. And if you are a youth association, or if you are a high school team and you utilize our fields, we will permit you to have your practices on there.
So that's a big change for those organizations, right?
It really is. I mean, if you think about it, our poor kids, our young athletes, it has had really a profound impact on them to not be able to practice. And while they still have to abide by COVID-safe practices and they still have to abide by the gathering numbers, at least they can get out there, they can do some drills, they can practice, run off some of that energy and enjoy being together in that capacity.
Great. And so let's talk about pools. One, are the pools going to be open soon? And two, do I have to wear a mask in the pool? That second one is a joke.
Thanks, Megan.
It is a joke. It is a joke to some people. It's a real question to others, and actually, I'm glad you asked it. So yes, I'm happy to report you too that our pools are going to be open. Now, the Aquatic Center, the very last time that the public health order was updated, the Aquatic Center was able to open for lap swimming at 25% capacity. So we have been open for lap swimming, but that's it. And now we can open for swimming lessons and other aqua-sized classes. So that means that Lions Pool will be able to open also. So beginning October 5th, we will offer swimming lessons, and Lions Pool will open for structured things like senior lap swim, aqua-size, and the therapeutic class, arthritis.
Okay.
That's great. I know our seniors will be excited to get back in there. We have a graphic for our visual radio here that mentions cross-pool exercise. What is that?
It's, a lot of our senior population, Lions Pool is a lifeline to them. They get up, they're sore, the joints may bother them. They may have had a knee surgery or a knee replacement, a hip surgery, a hip replacement. They come in, and cross pool is just walking across the pool doing therapeutic-like movements. So if you've had a knee replacement, you might be working on your 90-degree bend while you cross the pool. So it's just a way to have an unstructured therapeutic movement time.
Got it. We learned something new today, didn't we, Megan?
I totally did. I was like,
right?
That's what that means when I get tired of swimming and I need to walk. I'm just
you
switching
go.
to cross-pool
You're
exercise.
cross-pool exercising.
Cool.
There you are.
Yeah.
Now, Shawna Reeves, I want to ask you, too, still at Lions Pool and others, you've got to maintain that 10-person limit. Is that still true?
Yes and no. So for lap swimming, it's at a 25% capacity right now, and for the classes, it still is one instructor to 10 people. They must be 6 feet apart, and no, you don't have to wear your mask in the pool. And, we've seen things everywhere that tell people that, chlorine is a good disinfectant for the COVID-19 virus, so you don't have to worry about surfaces like ladders and things like that. But we will be doing COVID-safe practices for locker rooms and sanitizing there. And we will have our participants in classes spread out 6 feet apart. And we'll try to get creative. We'll try to offer as large of a class or as many spots as we can while still honoring the intent of, social distancing and keeping people safe. So if we can utilize a shallow end and a deep end and maybe host 20 people that way, we'll work to do that. So we'll do what we can to get people out there.
You're being creative during this time. A lot of folks are, that's for sure. And so this means too, though, the pool won't be open maybe the hours that it was open before being shut down. Is that right? The hours are going to be a little bit adjusted?
They are. That is true. And that just has a lot to do with learning to implement these COVID-safe practices. It has a lot to do with staffing and not necessarily related to budgets. While we have had some reductions in our budgets that have been critical, it's more about our staff. We have human people too, and we take precautions at work to protect ourselves from exposure to the virus, but it's inevitable. We do have people who have had first-hand exposures or they have had the virus themselves in the city, and if it's one of our employees, then sometimes that impacts and we have to quarantine employees. So with taking all of that into account, we are starting our programs out more limited and growing as we evolve and learn the COVID safe practices, and as we find better ways to keep people from being exposed to potential carriers. So Lions will only be open 7 a.m. to noon, and then the Aquatic Center will have also the adjusted hours that it has now, but we'll just incorporate swimming lessons into that.
Okay, good to know. And you mentioned, of course, just how important Lions Pool is to seniors in the community. I know they really do enjoy getting out and getting into that water for exercise and other things that we've already talked about. But this is will be a big deal for them to get back into the habit of getting out and going to the pool, even at reduced numbers. Is there a reservation system or anything like that to sign up for these classes or anything like that folks should be aware of?
You know, Scott, not right now. We don't necessarily know while we do know that there's a need for it, people are excited, we don't know how many. A lot of people are still staying in and staying home, so we're finding that when we do open these programs up, we are finding that we've been very lucky in having enough appropriate spots for the people who are willing to come out and participate, versus those who are still wanting to stay at home and be a little bit more cautious about re-entering the recreational world. So I think we're going to open it up and see how it goes. If we find that we need to do a numbering or a registering system, we may do that. But my advice to people would be that first week, call before you come if you're worried, or if you don't mind getting out and taking a drive to see how many people. But let us work through that, because we haven't had a problem yet, but we don't know. This is the first time this pool's been open for classes.
Understood. And so just to recap, Shawna Reeves, Lions Pool is reopening on October 5th, and folks can call 599-1187 or visit fmtn.org/pools for information, correct?
That is correct.
All right. And then for the recreational fields, I just want to kind of remind folks about that. They are reopening for reservations today, September 28th. You can go to fmtn.org/recreation or call 599-1195.
Correct.
Great. And so let's switch gears to the museum. What's going on over there?
Well, I'll tell you what. If you haven't been down to the museum yet, you're missing out. We have 2 great exhibits. Of course, we have the NFL exhibit, which if you love football, you should definitely go. If you don't love football, you should go anyway, because most people get in there and they are astounded at what we do have in there. And then the other little gem we have is the Inside Out exhibit, and it is a free exhibit. So if you go to the NFL one, you might as well just peruse through it. It's fabulous. I've had more people come out of that exhibit and say, wow, that's not what I thought it was going to be, and they really enjoyed it. So the museum is still open. You should go down and see those exhibits. It's easily social distanced. We have not had any problems there. There are not usually lines, but we've had a good steady flow of people, and I can't say enough about it. It's a nice addition to our community, so go out and see it.
Very good. And, of course, the museum was able to reopen a few weeks ago under the other amended public health orders, and they are just running on a percentage of occupancy like some other restaurants and retail stores, correct?
That's absolutely correct.
Very good. Well, Shawna, is there anything else that we need to share this morning? It's very exciting, I think, that things, every step forward, it seems like we're getting a little bit back to somewhat of a normal situation. I know that we're still limited as to how many of us can gather together at any given time, but reopening of some of these things like the pool and like the recreation fields, I think is a positive step.
I think it's a very positive step, and I think it's a much needed one. After so many months of just a very unprecedented situation, I think people are very, very happy to find some outlets. We all need that. It doesn't matter if you're during a pandemic or not. The way that the world works these days, with the number of hours we work, having smartphones making us connected all the time, recreation and work-life balance is so important. And I think that, seniors who are retired need that social connection. Kids need social connection. Working people need an outlet. So it serves so many, and I'm so glad that we're starting to reopen.
Agreed. Well, Shawna Reeves, thank you so much for joining us this morning. It's great to hear that we'll be able to get back into the pool. Scott, I know that you've been waiting.
I'm ready.
I know.
Cross Pool.
Megan, Scott, I expect to see y'all there.
We'll be there.
There you go. Thank you, Shawna Reeves, very much.
You bet. I hope you guys have a wonderful day. Thanks a bunch.
You too.
Bye-bye.
Like stereo.
Yeah.
There we go. Thank you, Shawna Reeves.
Live recording in a canyon.
That's right.
Okay.
Anyway, so great information again,
Yeah.
and more things opening again safely.
This is good. This is progress.
For recreation, so we're excited about that.
Yeah.
Excited about cross pool
Right?
exercise. Now
I had no
you
idea
know.
it had a name.
Now you know.
But it makes sense.
It does.
It's nice. You get a little gentle resistance.
Right.
So, anyway.
There you go. I like that. All right. Video audience, you got to see that.
Yeah. Radio audience. It was.
Use
you
your
can't really
imagination.
explain what just happened.
No, I can't.
Okay.
There's no words. No words. Anywho.
Hey, I have a story. Sort of.
Okay.
But as we know, it's census season.
It
right?
is census season. That's right.
We've been trying to plug that as much as possible.
Very important because, yeah.
Super important because it is directly tied to the amount of federal aid and state aid that we receive for our programming and all of the ways that taxes benefit us.
Right. Now you say we, but you don't mean KSJE, you mean San Juan County.
I mean like everybody in the United States, but let's hone in on our county because a 1% undercount translates to $30 million in funding lost to our county over the next 10 years. So they take a census every decade.
Yes. So to San Juan County, that's $30 million over that next 10
Lost
years.
if
$3 million
it's an
a year.
undercount.
Right.
Yeah.
Every 1% undercount.
Every 1%. And so far, our folks in Albuquerque at the Albuquerque Foundation suspect that we might have a 25% undercount.
Wow.
We should have done the math before we brought
That's
this
a
story
lot.
up.
Well, that's a lot. If that's, it would be the 30 million times 25, right?
I guess.
Points times 10 years.
Yes.
Right?
Yes.
Over 10 years. Over 10. That's a big.
Well, it's 30 million over 10 years. Yeah,
Right.
but like you
So
said, it's 3 million a
25
year.
points under.
Right.
Would be a lot.
Yeah.
Yeah.
So this is just to say that this is another gentle plug. Fill out your census. It's not hard. It takes 5 minutes tops. It's very easy. But another complicating factor this year, of course, is COVID-19.
Right.
Because normally for folks that don't have, either the address isn't recorded or it's a very undercounted area. So it's an area that doesn't get a lot of return on
Right.
census reports. They send the door-to-door folks. I don't know if you've ever had a census worker come to your door
Not
or not.
in my
but-
recollection, because I've always sent mine in, I think, ahead of time,
Yes.
so I'm off that list.
Yes. So there's a lot of reticence for folks to do that and sign up to do that because of the pandemic. They
Right.
don't really want to go to doors and knock on them and be welcomed inside. But the CDC and the Census Bureau assure us that, it's a relatively low risk when it's just one-on-one and they're wearing masks. And
Well, they're
so-
going to be in like PPE, I think, too.
yeah, they're
right?
going to be in the full garb. And so this is to say that the pandemic is very complicating. Another complicating factor is, specifically as it pertains to our area, that sometimes folks who live out on the reservations don't have addresses. So if you have a P.O. box, it's a lot harder to
True.
count you. And so anyway, I read the 30 million over 10 years and the 25% undercount, and it's like, oh my goodness, we're gonna miss out on millions and millions of dollars
True.
that are needed.
Exactly. So we encourage everyone to fill out their census if they haven't done so already. The original deadline has been moved. It was now September 30th, but I believe there's been a court ruling that has now extended that
Yes.
to the end of October. But don't let that mean you have a lot of extra time. I would still try to get it done as soon as possible.
Yeah, it's
So-
not something to procrastinate on.
No, really not. And again, it means a lot. And there's a lot of, I know the funding goes for schools and roads and bridges and other programs like the food bank and other things that are being very helpful during this pandemic, United Way and things like that. So lots of good reasons to fill out that census to be counted. Mm-hmm. And so, and when you put it into dollars and cents like that, 30 million, that's a lot.
It's a lot.
So
Times 25,
there
if
you
the
go.
prediction is correct.
Right. So good point. Well, thank you for bringing that to our attention.
You're welcome.
Very important.
Get counted.
That's true. Very true. Well, I think that brings us to an end of our show today. And so we thank you for joining us, everybody. Thank you for tuning in. Again, please share this with your networks and your friends. We are on Facebook and YouTube. And so you can hear this again, of course, at noon on KNMI Radio, at 5 p.m. on KSJE Radio. And so we encourage you to share this information. We think it's important. We try to talk to folks who are kind of in the know to share that with you. And so that's the whole point behind the show.
Yeah.
So
thanks for tuning in. See you Thursday.
Yeah, coming up on Thursday, we're hoping to speak with a mental health expert and also some folks from waste management.
It's going to be awesome.
You're looking forward to that, aren't you?
I'm so looking forward to that.
Okay.
We got
Don't jinx
trash,
it.
we got our brains.
There you go.
It's perfect.
Okay. We'll see you Thursday. I can't go any further with that line of conversation. Have a good Monday, everyone.